But as I've said before, this is a team effort. It's a Team Ontario effort. We need every single person, every single household, and every single business doing their part. For months, we've been promoting the public health guidelines, and most people are following them. But clearly, some are not. And that's where our provincial inspectors come in. To date, we've conducted education and enforcement blitz in 7 different public health regions. In fact, over the Thanksgiving weekend alone, we visited over 400 restaurants and bars, as well as 100 gyms and banquet halls. Most of those businesses were receptive to the visits, because these inspections aren't just about enforcement. We're educating our business owners. We're coaching them on how best to protect their employees, customers, and the general public. And the good news is, the vast majority of the businesses we visited, they're following the rules. They're taking the situation seriously. So thank you to all the business owners out there who are doing their part to stop the spread of COVID-19. We're going to continue to support you while cracking down on the bad actors out there. That's why today we're launching another series of workplace health and safety and education and enforcement campaigns across the province. We're deploying 200 provincial offence officers from across several ministries to visit as many businesses as we can in hotspots across the province. These proactive inspections are a key tool to get to areas when they're in yellow and orange. These are critical preventative measures to help stop the spread and avoid these areas going to red. We'll ask each business that is required to have a COVID-19 safety plan to provide it to us in writing. And we'll work collaboratively with them to make sure they have the best plans in place to protect their customers and workers, based on the latest medical advice and workplace health and safety information available. I also want to send a message to the rule breakers out there. My friends, we have to tighten things up. We can't accept anything less. And for any bad actors out there, to anyone who knowingly and deliberately breaks the rules, will not hesitate to fine you and shut you down. With the high numbers we're seeing in some places, we can't afford to have workplaces that are unsafe or host large gatherings or parties, because this virus spreads like wildfire. It hurts your customers, it hurts your workers, and it hurts your community. It's that simple. My friends, we're all in this together, and we all must be part of this solution. We have to avoid the worst case scenario at all costs, and I can assure you we are prepared to do whatever it takes to stop the spread of this virus before it takes a greater toll on our loved ones. Tomorrow, our government will release further public health restrictions based on the best medical advice. And as it's looking, these measures, they will have to be tough in the hardest hit areas. We're seeing concerning trends. Our hospital ICUs are in jeopardy. Our long-term care homes are at risk. We have some difficult but necessary decisions to make. But today, I'm asking the people of Ontario to listen, especially with the holidays quickly approaching. We can still head off the worst. We can still protect our hospitals and long-term care homes if we follow the public health measures. We can save countless lives, and that's worth everything in the world. Thank you, and God bless the people of Ontario. I'll pass it over to Minister McNaughton.
Well, thank you very much, Premier, and good afternoon, everyone. Since the start of this pandemic, the top priority for my ministry and our entire government has been making sure everyone comes home to their families safely after a hard day's work. To ensure that happens, we're taking deliberate steps to stop the spread of COVID-19, and we know that most workplaces are too. My ministry has had boots on the ground since the start of this pandemic, conducting over 27,000 inspections. This new safety campaign further supports communities across Ontario. In the past month, provincial officers have visited more than 1,000 workplaces in 7 communities as part of this targeted effort. From big box stores in Mississauga to nail salons in Waterloo, our officers are educating and guiding businesses on staying safe and staying open. They are checking that businesses are following public health measures, such as completing a workplace safety plan. These plans are now required by certain businesses in public health regions identified as being in the protect, restrict, control, or lockdown level. In Peel Region, for example, a 2-day campaign at the beginning of November saw 56 officers visit over 300 stores. They found that more than 80% of businesses are doing the right thing, and any contraventions that have been found have been resolved through education and some immediate adjustments. Businesses want, above all, to keep workers employed and continue serving their clients. However, we won't hesitate to ticket any and all businesses that are blatantly and deliberately disregarding the rules. The successful campaigns in Peel Region, London Middlesex, and now in Waterloo are just the beginning. The officers who volunteered for these campaigns are part of a province-wide multi-ministry team of more than 200 officers. They are working mainly in higher risk areas of the province and regions that request additional help. Over the next few weeks, they'll be in Toronto, York Region, Ottawa, Eastern Ontario, and more. These campaigns wouldn't be possible without the more than 200 guidance documents, videos, posters, and tip sheets that have been posted online. Over 1 million employers and workers have already viewed these resources. Again, they're available at ontario.ca/COVID safety. Finally, I'd like to echo the requests that have been made by the Premier, the Minister of Health, the Chief Medical Officer of Health, and others. We all need to work together to stop the spread of this disease. We need to wear masks, wash our hands frequently, keep 2 meters apart, avoid large gatherings, and stay home if you're feeling ill. People's lives and livelihoods depend on it. Thank you.
We'll go over to the phones for questions. First question, please.
Your first question comes from Melissa Candelaria with Your TV Halton. Please go ahead.
Hi, Melissa.
Hi there.
Hi.
I'm actually going to be digressing a little bit from COVID-related issues here. My question is, Bill 218, supporting Ontario's recovery, a Municipal Elections Act, was passed Monday. In this bill, ranked ballot elections were mentioned. In Halton, Burlington had expressed an interest in this form of voting and was preparing for public consultations. Other areas like Kingston, over half of its residents voted in favor of it back in 2018, and London has already used this type of voting. But this bill essentially forbids municipalities from going to a ranked ballot system. So I was just wondering why prevent municipalities like Burlington from going to a ranked ballot voting system? What effect does it have on the province if municipalities want to go this way?
Well, we want standardization right across the province. We've been voting this way for 100 years. Why throw a wrench into things and try to confuse people? It's very simple. The first past the post. Whoever gets the most votes gets to become a councillor, gets to become a mayor. It's pretty simple.
Follow up?
Okay, great. And just from one bill to the next, I guess, our Halton mayors, along with Conservation Halton, had sent you a letter this week proposing changes to the Conservation Authorities Act in Bill 229. In particular, they're asking you to remove Section 6. They believe it relating to governance, ministerial authority to issue permits, removal of the ability to appeal decisions at LPAT, things like that would actually negatively affect the process. So will you consider removing Section 6 for now, as they're asking you to do so, and consult with Conservation Halton and our local politicians to find what they're calling a more appropriate solution?
Sure, I'll consult with the Minister of Environment, and the Minister of Environment will reach out to the folks over in Halton there.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
How do you, Mike?
Premier, you mentioned what's going on in the hospitals. The admissions to the ICUs of COVID patients have been, increasing for weeks, and there've been a lot of, alarm bells being raised by intensive care doctors and media reports. So now that we're basically at the threshold of 150 patients, that you've said previously is going to make it hard to maintain other medical procedures. What action are you going to take now to deal with this?
Well, the backlog surgeries we're going to continue. We increased capacity on both ICU and acute care. I believe it's 2,350 more beds, and I could be wrong, but I believe it's pretty close to 2,350. And we're going to continue adding surge capacity within the hospitals.
Follow up?
Minister McNaughton mentioned staying home if you're sick. So this is actually a question more to the Premier, though. you're telling people that they should stay home if they're sick. That if you're a worker who doesn't have sick pay, that might be a difficult thing to do. So I'm wondering, if you have any regrets about why your government's making that decision to take away the mandatory right to at least a couple of paid sick days a year.
Yeah, actually, the federal government, I appreciate it, on the restart agreement, they put in $1.1 billion. So anyone who is feeling sick, they'll have 2 weeks pay. We've also passed legislation to make sure that no one can be let go from their job. So if for any reason you're sick because of COVID, by all means, you're eligible. Or I'm sorry, just sick in general.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. Today, Critical Care Services Ontario reported the ICU threshold of 150 COVID patients has been reached, and it released this data well in advance of the province releasing its data. And we wanted to ask why that's happening. Shouldn't this be released by the province to keep the messaging consistent? Because the province's data today says there are 146 COVID patients in the ICU.
Yeah, if you don't mind, I'll pass it over to Dr. Williams. Thank you.
So the data, there's two forms as we've done in the past with administration from sectors. So we have the critical care data and they collect that. And the combination between the two, as you see, there's a slight difference between the two numbers, delays in reporting and how that goes forward. So if there's slight differences, we look at those, we try to address and get them as consistent as possible. If it's a difference of, say, 5 or 10, it's one thing, it's just a delay in reporting. If it's huge, then we have to look at what has happened in our processes and systems to make sure we're more congruent and consistent with our data reporting.
Follow-up?
Thank you. And my follow-up is for you, Premier.
Yes.
Regarding the number of vaccine doses the province is hoping to get, Minister Elliott says the numbers she gave yesterday were based on per capita, that the province expects to get 2.4 million doses. In any of your discussions with the Prime Minister or Deputy Prime Minister or anyone else in the federal government, has a firm commitment actually been given on the number of doses the province will be getting?
Yeah, so good question, Ellie. We ended up getting that off senior officials from the federal government. I just talked to senior officials in our Ministry of Health. They did confirm, they spoke to someone in the federal government, the senior officials in health, I presume, and for planning purposes, they told us that we would get 1.6 million doses from Pfizer and 800,000 doses from Ontario. But in saying that, you have to divide that by 2, so it's 2.4 million. And so that will allow us to do 1.2 million tests. And I appreciate the feds. It's going to be trickling out because everyone wants it. And really, why shouldn't we get 40% per capita like we always do? So there shouldn't be any discrepancy whatsoever.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Hi, Jeff.
Thanks. Hi, Premier. I wanted to ask about, you mentioned the tough measures that are going to be discussed at Cabinet today and I think tomorrow as well before an announcement's made. Are there any discussions that are going to happen about supports for businesses that might be asked to close or see their revenues plummet as a result of those new measures? Or is it is the province's $300 million fund and the other thing that's announced, is that what support is on the offer?
Well, right now, that's what we have on the table, along with the federal government. If you add everything up, it's billions of dollars that we're going to support small businesses, but we'll never turn our back on them. There's always more money to support them in certain scenarios. But we'll always be there to support them. But there's billions of dollars, no matter if it's the hydro rates that we're going to be taking care of, or 90% of the rent, or 65% of their payroll. On top of that, we'll take care of their property taxes, any fixed overhead gas costs. So we're trying to take care of all fixed overhead costs. And I realize, you know, something, nothing's better than opening your place up, but we're doing everything we can to take care of the overhead costs. And on top of that, they're eligible for a $60,000 loan, and I believe it's June 2022. If you pay it back, then $30,000 of that will be forgiven.
Follow up?
Oh, thanks. Yeah, no, as you mentioned, the measures that we can expect will be tough, but they haven't been decided upon. You're going to get some recommendations, I understand, from Dr. Williams. But can you give us a sense at all the scale of what we're talking about? Are we talking about a major disruption to retail, an attempt to reduce the sort of crowd scenes you see at malls, you know, shutting down stores or going back to a stage one type situation in certain parts of the province? Is that the scale of what's being contemplated?
Well, we're going to take the recommendations from Dr. Williams, and then we'll have to make a decision. And I'm 100% upfront here. I don't have the recommendations right at this moment, but that will come to cabinet, and then we'll take it from there. But I'll pass it over to Dr. Williams.
Yeah, and as the Premier said, in fairness, we have given those recommendations to